Alexis, Mariah, Alexa, and Dr. Sawyer. It's nice to kind of see you all. Hope you're doing well. So for my presentation, I decided to pick the topic of the Samoan measles outbreak that started last September and kind of went until late December, early January, and really affected a lot of the people there in Samoa. It took over 80 young lives, and it was really impactful on the community and just people who are living there. And I think that this was also a really good topic for me to pick, just because it's kind of in line with what we're dealing with right now with the coronavirus, but also gives us as nurses like kind of tips and different perspectives on how we can like help people affected by coronavirus now, but also just gives us that perspective of like we're not the only ones who've struggled with something like this. There have been other cases, and other people have been negatively impacted by a disease in the way that we're kind of focused on ourselves and coronavirus at this moment. Yeah, it's good to highlight other cases. But so when I was researching about this epidemic that took place in Samoa, there were a few essential services that really stood out to me, and those were informing, educating, empowering. That's one. Mobilizing community partnerships, linking to and providing care, and enforcing laws. And the aspect of informing, educating, and empowering people really came into play with vaccinations, because people in Samoa before the outbreak, most of them hadn't been vaccinated, especially vaccinating their children, because there had been an incident the previous year where there was a baby who passed away from an incorrect vaccination, and it kind of sent this like anti-vaccine sentiment throughout the whole country, kind of setting them up for this kind of outbreak in a way. So it was really important that organizations brought people to the Samoan people to educate them properly on vaccines, misconceptions, their importance, stuff like that. And also mobilizing community partnerships really came into play with like groups like World Health Organization, and just like within the community of Samoa itself, people really came together, helped out. Women donated like nappies, like those diaper things for babies, to the hospitals who were in need, and opened up soup kitchens for other people during this time of need. So that was also just a really like important but like not really thought of fact of helping out during this epidemic. And then in terms of enforcing laws, that was kind of seen when the Samoan government sent out like a stay-at-home kind of order, but just for like children under 14, as they were the most susceptible. And also there was the aspect of linking people to care, and that's really just seen in bringing them necessary medical supplies, encouraging them to go to the hospitals, and just bringing vaccines to people who hadn't already gotten the virus was really important as well. And so my recommendations for like the 3 levels of care. So first, primary prevention, as I've been talking about this whole time, has been vaccinations. Vaccinations are very important, and this was one of the primary prevention strategies in fighting this outbreak. And I think that it might even be good to make sure that these vaccinations are brought directly to the people's houses, so like to limit exposure of children with each other. And then the secondary prevention would kind of be like the stay-at-home orders, just like for those who already have it, to not be in contact with other people at that time, especially like children, like to go out and play. And then the tertiary prevention would be, in my opinion, like assuring a competent workforce in the hospitals. So that would be like ensuring that hospitals are well equipped with supplies, joining together to make sure that they have enough supplies to meet the needs of the people